Welcome, everyone. Thanks for joining the Society for Clinical Research Sites for SCRS Talks, where we have our guests take a few minutes to address issues of site concern, and in this case today, patient concern. In this installment, we're going to have TJ Sharp and Dave Azer take a few minutes to talk about the patient's voice in clinical trials. In this episode, they're going to talk to each other, so I'm going to step back, let them introduce themselves, and do their brief interview. Good morning, guys.
Good morning.
Good morning, Michael. Thanks for having us here.
You're welcome.
This is TJ Sharp. Welcome, everybody, to SCRS Talks. I've been fortunate enough to be involved with SCRS as a patient advocate and representative and someone who shares my story with site and research personnel for a number of years. And today, I get the pleasure of sort of hosting a quick virtual fireside chat with a friend and a fellow advocate and melanoma patient, Dave Azer. Dave, you want to take a few minutes and introduce yourself and maybe give us a little bit of background as to what your story is?
Sure. Thanks, TJ. Always good to spend time with you. So my name is Dave Azer. I am a stage 3 melanoma survivor. I was diagnosed a little over 5 years ago. The melanoma was on my face and it spread to some lymph nodes in my neck. And one of the parts of the experience that I'm convinced got me through it to where I am today was my very productive, beneficial experience with a clinical trial. When I was diagnosed with stage 3A, there weren't very many good options for me in terms of treatment. And through some research and some diligence, I was able to find a trial, which we can talk about in greater detail. And I'm convinced that that trial is part of the reason, if not most of the reason, that I'm alive and healthy today. So I'm super grateful. And one of the neatest aspects of all of it was that I got to meet TJ, and we've become really good friends, and we share a bond.
We do. We share a diagnosis and sometimes the stage together, telling our story for those of you who don't know. And it seems like it's been SCRS's mission to broadcast my story to the sites around the world. But for others that have not heard, I am a stage 4 melanoma patient, or at least I was for a long time, diagnosed 8 years ago, and given 2 years to live. Was unable to find initially a treatment or a trial that would give me a chance to watch my 2 little kids grow up. So through a number of different missteps in the world, I was able to navigate past not being offered a clinical trial when the immunotherapy world was just beginning to take hold in melanoma. I did find a trial. I had to, as the SCRS founder, Christine Pierre, liked to broadcast that we're not going to let what happened to TJ happen again when my contract for my clinical study wasn't signed, and I sat there in limbo for over a month. So I'm happy to report that I am 2 clinical trials into my treatment, and much like Dave, I'm in great health here as the world turns to face a different health crisis. So Dave, and for our listeners, the background is that I'm an IT project manager before I became an advocate, but Dave is personality on television down here in Fort Lauderdale, where we both live. So me interviewing him is like the student interviewing the master. So
you're doing great. You're nailing it.
Let's talk first about some of the commonalities that we have, and then we'll dive into both of our research experiences, Dave. Dave and I have come up with a story that we share. We call it stage 7. His stage 3 and my stage 4 comes to stage 7, and it really was about the parallel highs and lows. Even though our journeys may have been different in a lot of ways, that we both sort of hit rock bottom is the word that you used a lot. Dave, tell me what that was like, and then how transitioning into a clinical trial gave you some more hope for outliving the expectations you had that melanoma was going to take you any day.
I had just turned 40 and was the happiest I had ever been. I was on a cruise. I was living my best life. Everything was perfect. I was feeling invincible. And then I had noticed a mole on my face. It had been there for a bit, but it was starting to change. It was starting to get bigger. It actually was bleeding a little bit. So here I am on this cruise thinking how perfect life is, but also saying, this mole is not what it once was. I'm getting a little concerned. So when I got back to South Florida, I went to a dermatologist. Long story short, he pretty much biopsied it, diagnosed me with melanoma, which led to a first surgery, which I was told was probably going to be fine. The mole was pretty small. The doctors were anticipating that they would take it out. They would get the margins. They were going to take out a handful of lymph nodes, 8 lymph nodes, and fully expecting those lymph nodes to be fine, that this would just be kind of a wake-up call for me to wear sunscreen. So I had my surgery, and by the way, as you mentioned, I was on TV at the time, still am, and the surgery was on my face. So another concern was, how am I going to look when it's all over with? But after the first surgery, there was a plastic surgeon who came in as well. I was going to be fine. Cosmetically, I was going to be fine. Physically, emotionally, everything was okay, until I get the call from the surgeon 2 weeks later, and he asked me if I was sitting down. And as I'm sure you know, when you get the "Are you sitting down" call, it's never good news. So I went into my office at work, and I closed the door and I sat down, and he proceeded to tell me that, much to his surprise, 3 of the 8 lymph nodes tested positive for melanoma. So it was starting to metastasize. And shortly thereafter, I was diagnosed with stage 3. I had a second surgery that was 14.5 hours long. And in that surgery, the doctors took about 60 lymph nodes from the left side of my neck. They took the parotid gland from the left side of my face. And then there was massive plastic surgery, because this was a serious operation. So I had a lot of reconstruction. And, from there, it was everything that you and I have talked about on stage. Physically, it was brain MRIs and PET scans and CAT scans and oncology visits and the clinical trial. But emotionally, for me, man, it shook me up like nothing ever before. I never expected to hear the words, "You have cancer," and then I never expected to hear, "You have stage 3 cancer." And then I looked at survival rates and recurrence rates, and I was convinced I was going to die. So for me, I really did hit rock bottom emotionally and mentally the first couple of years of this process. Every day thinking, is today the day it's going to spread to my brain or my liver or my lungs, and that's going to be the beginning of the end.
So with that background, what would you want someone at a research site to articulate to a newly diagnosed patient, someone who comes in and has that fear? Maybe they don't even know they have that fear. They're certainly not going to voice it and try to put up their brave front. How would you want someone to have approached you and proactively address that? Talk to you about, hey, this is scary, and it's not easy to deal with being a cancer patient, but here's how we can help you. Here's how someone can help you navigate the mental and emotional journey you're about to go through, especially with the unknowns of clinical research if you're a trial participant.
It was challenging for me, because where I had my surgeries, the oncology there was no clinical trial available for me at that hospital. So after the surgeries, when I visited with the oncologist, there was no, "Hey, we've got this option." There was, "Look, you're stage 3A, which means we can give you interferon, or we can do nothing really other than just monitor you and bring you in for, visits every 3 months. But we don't have a clinical trial option." So, obviously it would have been great to have that option immediately right away. But also, to your point, there wasn't a whole lot of, anywhere I went along the way, there really wasn't a whole lot of emotional check-in. I've talked about this a lot. Your journey was physically was unbelievable, what you went through physically. It's incredible. For me, physically, other than the surgery, wasn't too bad. But for me, emotionally, I had a ton of anxiety. I really did not do well emotionally and spiritually. So I would have loved a check-in. I would have loved, "Hey, we're going to give you a therapy session. Go do this now." Because left to my own devices, I didn't seek out therapy for a while. I didn't believe in it at the time, which in retrospect, was a big mistake. And I'm a huge advocate for people going to therapists, because you need to talk to someone. But I would have loved for someone to say, "Look, yes, physically you can expect this and this and this, but let's sit you down and have you talk with someone emotionally." When I did find a hospital with a clinical trial, then I started to feel much more optimistic because even though it was only a trial, it seemed like there wouldn't be side effects unlike interferon, and there was a real chance that I could make it.
That is, it parallels a lot with what my story entails. You mentioned the physical difficulties, and I had emotional trouble as well. More along the lines, I had a young family, and I had a 2-year-old daughter, a 4-week-old son, and if you ever get the chance to see Dave and I talk, you'll see all of this in slides and these beautiful pictures that tell the story of what it was like to journey through this diagnosis and have that fear of not being able to see your family grow up. Dave's a new father now, and he understands probably a little more what that would be like if someone told you you're not going to get a chance to see your boy go to kindergarten. So my emotional journey wasn't quite the same as Dave's, but certainly there's a huge aspect of how do I deal with this. Luckily for me, I didn't have to worry about being on TV, so it didn't matter what I looked like.
But for people who don't know your story, and I understand a lot of our listeners already do, but for those who don't, I've always been so impressed by you, honestly, and I really truly mean it, because what you went through, you said in the introductory remarks a few minutes ago, essentially being told to just go home and spend time with your family because there's nothing we can do for you. And you just saying, no, absolutely not. And you fighting to get a trial, and then you fighting to get another one. And then you being your own lawyer of sorts and advocating for paperwork and contracts. So much of your story is so courageous. And that's why you're sitting here today, because you fought for yourself, which is just so amazing, man. I've always been so proud of you.
Oh, thank you. I appreciate that. And this is why Dave is a TV personality, because he can take any story and make it sound good. Let's quickly talk about the world today and what we're all dealing with. There's a virus going around the world, pandemic going around the world, and there is no treatment for it. There is no vaccine for it. For that to happen, people need to participate in clinical research. We can't just have politicians say, hey, just give this a shot, maybe it'll work. We want to have a treatment for particularly for the population who are most vulnerable. What would you say to someone out there who's looking or has some kind of health challenge and is now dealing with the dual threat of this pandemic? What would you say to them as far as participation in clinical research, and also how to handle that mental part of worrying about being healthy as well? Because I know there's two questions there, but what is their path forward? Yeah,
it's interesting because when I signed up for the trial, and I didn't have a lot of options. This was the only clinical trial available to me in South Florida. I probably could have traveled to maybe find another one, but it's just really inconvenient to have to do that. So when I agreed to do this trial, it was 75% active and 25% placebo, which is certainly not ideal. So I knew that risk going in. I knew that obviously it was a trial, so it may not work going in. But one of the things that I did that I'm so thankful for was I spoke with literally my best friend, who happens to be a head and neck surgeon, which is, a great miracle along the journey that I had friends who were physicians. And we talked about this trial, and he said to me, look, if you're going to do this, you can't worry about if you're getting the active medicine or if you're getting the placebo. The placebo effect in the medical community is a real thing. Patients have responded to treatment, even if it's a placebo, just because they believe they're getting real treatment. So if you're going to make this decision and take this clinical trial, you are believing from right now that you're getting the active drug. We're not having this conversation again. You're not worrying or wondering about it again. You're getting the active treatment, and that's it. So I went all in. So to answer your question, I think if you're going to take a trial for COVID or for cancer or for anything, if you're going to do it and believe in it all the way. And even for a guy wrestling with as much anxiety as I was wrestling with, and literally waking up every day going, starting my day by feeling the lymph nodes underneath my armpits to see if they were swollen. That's how I started my day for 2 years. Even in the midst of all of that anxiety, I still did believe that I was getting the active treatment. And every time I went and I got my injections in my arms and my leg, I I visualized the cancer inside of me dying. I visualized this treatment coursing through my veins and finding the melanoma and eradicating it. So I would say, as much positivity as you can surround yourself with, that you can create on your own, go all in. Because as you and I both know, the mind is super powerful. You're so mentally tough. Look at you now. You're an endurance athlete. Have you competed in any Ironman triathlons in the last 2 days? I haven't talked to you.
No, the COVID diet has not set me up well for endurance sports these days. So,
gotcha.
What Dave doesn't point out, and this is sort of a good little segue, or maybe an additional point to that, is that the mind is a very powerful thing, and Dave is a self-admitted hypochondriac. One of my favorite stories to tell people is that I would get my scan results, or I wouldn't get them, or I get a call from my oncologist, and I just shoot Dave a text or put it on Facebook, and he'd call me like 12 hours later and go, "What are the results? What happened? I'm so worried for you." So there was a negative.
You did this to me a few days ago. TJ sent me a text a few days ago, and he goes, "Do you want the good news or the bad news?" So immediately I'm like, "Oh no, is he going to tell me, did his melanoma come back?" And and it was about something totally different. You can't do that to me, man. I worry about you.
I know you do. You worry about yourself, and it's good that you have taken that and make it a positive, because in one of our slides on the presentation, Dave talks about how he kept getting these random he had a throbbing in his head. He thought it was bone cancer. It just was a cyst. There was a C in his eye. He was smelling smoke one night on vacation and thought Mexico was on fire.
I went on vacation in Punta Cana, smelled smoke from the hotel room, went outside, couldn't see a fire, so immediately I was like, well, that's brain tumor. That's an imaginary smell. I have a brain tumor. This is the end. Which I can laugh about now, but at the time was terrifying. And it turned out that there was, in fact, a fire. I just couldn't see it from my vantage point. And there's no shortage of stories about, I was in a movie theater watching a movie, my foot fell asleep, and rather than just thinking, oh, my foot's asleep, I thought, well, now I have a spinal tumor.
And you can read all about this in Dave's book, Hypochondriac's Guide to Beating Cancer.
Correct.
Yeah. I think we have just a couple minutes left, Dave, so I wanted to kind of wrap up and talk about one more thing. And I'm going to preface that with kind of what I've done. You've known a lot of it. So besides speaking to pharmaceutical companies and clinical research, I'm actually part of the clinical research world now. I work with several different pharma companies to bring the patient voice in. I work with a group called Transcelerate, who some SCRS listeners may be familiar with, as their patient advisor to make clinical research better for everyone involved. And my life has now become being that patient voice for those patients that can't speak for themselves. So I do a lot of work in that, as you know. You mentioned something very early in the podcast about living your best life. And when you and I speak, we talk about things like determination and ownership of our health, resilience, perspective. What would you want? What's that sort of final thought you would want clinical research professionals to know, the doctors, the CRAs, everyone involved in that whole behind the scenes thing? You and I get to be the face of it. You're the pretty face of it. I'm the bearded COVID beard face of it. What do you want those people to know, both from a patient standpoint and then someone who represents others, about what it's like to be on one of their trials?
Well, first I would say thank you to them, because you're giving hope to people, you're giving options to people, and optimism to people. So thank you for the work that you're doing, and I can tell you that personally from my own experience. What I would tell you is, if you're a scientist and you're in a lab all day and you're looking at test tubes and you're trying to create vaccines, you may be detached from the patient perspective, but to meet someone who has survived late stage cancer because of a clinical trial, it's an overwhelmingly incredible feeling. People were dying years ago because there weren't these vaccines and these trials didn't exist. And now, because of the work that you all are doing on the front lines, you're saving lives. You saved my life. You saved TJ's life. So I would tell you to keep pressing forward, and it might do some of these scientists and some of these doctors some good to maybe go to a cancer center and see their work in action. I don't know if that's feasible, but to see the impact that you're making on people. Everything that I have gotten to achieve in the last 5 years has been because I survived cancer. And again, in large part because I believe because of the clinical trial. I got married. I have a child. I get to be an ambassador in the fight against cancer. I get to do all these wonderful things because of the work of the clinical trial community. So I would just say thank you. And I would tell you to keep doing what you're doing. You're making a huge difference.
That is great, and I can't think of a better way to end it other than saying it's really unfair to give a hypochondriac a newborn and then a pandemic in the same year.
Yeah, he's 3 months old today. In fact, today he's 3 months old, and his entire life has been defined by COVID. He doesn't know any better, but we'll tell him the story when he's old enough to appreciate it.
Oh, that's great, and that you know what, that resonates with me so much because that's been sort of Tommy's life. He's always had a dad with cancer. Josie was 2.5, so doesn't really remember much before this. But so much of when I measure myself, it's all right. He's coming up on his 8th birthday. Well, that means that's 8 years for me. And he's you go from, we have our little pictures in our slideshow of him just kind of curled up in my arms, and now he's beating me up in hockey in the front yard and playing on the beach once we get back out on the beach. So I think my final thought is this. I always echo the sentiment that Dave had about the thank you. That's how I try to end my talks, and when Dave and I both talk, we do the same thing because there are so many people out there whose lives are affected, and if you're not right at a site, or you're not one of the people that are interacting with patients on a daily basis, you probably don't get that reward of seeing little Tommy come in with me, or seeing how you affect families who get more time with their loved ones and get a chance to enjoy their life, either a longer life or a better life or a healthier life. So for all of us, I think that Dave and I both echo the thank you and the appreciation sentiment, especially now, given that clinical research is going to be on the front lines and is going to be sitting there developing cures for, developing vaccines for this virus that has neither. If Dave, if you have any extra thoughts, pop them in there. If not, I just want to say thank you to SCRS for letting us invade your podcast for a few minutes, and I think we look forward to interacting, maybe potentially at a future Site Solution Summit with the audience here.
Yeah, thanks. You've done 2 of them, so the door is always open. Well, thanks, guys, very much. Wow, Dave, I hadn't heard your story before. I've heard TJ's several times, and geez, just amazing, just amazing. And thanks very much for your time this morning and for your stories. And we're going to get this out. The goal is to release this on the 20th, which is Clinical Trials Day. And so I was glad that you all could squeeze me in with very little notice and knock this out. So thanks a lot. For everyone listening, thanks very much for listening. Make sure you register for our upcoming webinars and discussions as part of our summit. Our webinar series. Go to myscrs.org and visit our Learning Campus. Check out the SCRS Insight Journal. We publish that quarterly for members. You can find that in the members section of our website. Again, myscrs.org. We appreciate everyone's participation in today's program and look forward to bringing you more great content like this in the future. Thanks very much, TJ and Dave, for your time today.
Thank you, Michael.
Everyone. You're welcome.